For our final segment, let's talk about the Affordable Care Act and what we have learned and where we see the world going. So the Affordable Care Act is about 5 years old. Of course, various elements of it have just been implemented more recently. So the legislation was passed in 2010, but bits and pieces have been implemented. And of course, there have been some challenges as well, resonating all the way up to the Supreme Court level. I guess I'd really like to just kind of hear from you all in terms of what the effect of the ACA has been to date. And we can talk about this in a number of different areas. Why don't we start with coverage and access? That's probably the most obvious one in terms of what people often think about when they think about the ACA. So Austin, maybe I'll start with you.
I'm just going to start actually with an issue. I'm sure other people will jump in on what's been accomplished. But the issue that I noticed is that though insurance rates have increased, broadly, there's huge variation across states. That's because Medicaid expansion is not complete. It's because engagement with the health insurance marketplaces is not complete. It may be because what's being offered there is not attractive to all segments of the population. Whatever the reasons are, there's zero agreement about what to do about it. If one thinks there is a right rate of insurance, maybe you think it's 100%, or maybe you think there's some sort of it's okay to have a few percent or something. But whatever you think it is, we're clearly not there everywhere, and we're not really having a conversation about what to do next about that because we still haven't gotten over, is the ACA, communism, or is it a great thing kind of debate.
Mm-hmm. What about this notion of affordable insurance? We talked earlier about high deductibles, and on the exchanges, of course, you can have the gold plan, the silver plan, the platinum plan. Do we focus too much on how many people actually have an insurance card and not enough on sort of what risk or at what level of insurance they're at? Any thoughts on that?
I do think you're right about that. I think that's the right way to think about it. And I'm a big proponent of value-based insurance design, but I'm also well aware, as I said before, that it's so much easier to say the deductible is $5,000, period, instead of saying, well, the sleep center is not getting covered, or the back surgery needs a prior authorization, or whatever. It's much easier not to micromanage. But the effect of these high deductibles is to, unfortunately, put barriers to appropriate care many times. So, I think there's a lot hidden under the insurance numbers that we need to be paying attention to.
Mm-hmm. Leah, you work with many large employers, some self-insured employers. Has the ACA, when we think of coverage in the exchanges and Medicaid expansion, has that had much of an impact on the employer populations you work with in terms of their covered populations?
Oh, very much so. Starting with compliance, I think most employers have spent pretty much a year, the first couple years of ACA doing nothing but figuring out how to comply with it. There are enormous numbers of regulations that they've had to change. I think they're frustrated with a couple of recent regulations that have come out that very abruptly changed the rules on them. So, for example, a new regulation just came out changing maximum maximum out of pockets for individual consumers. Now, it's one thing to say, well, we are for or against that, but it's another thing to say to employers make that change in a few months. It's an enormous change for them. So there are a lot of compliance issues. They've also have been very interested in the value, the movement toward value that the Affordable Care Act has brought us through CMS. I think in a positive way. I think they want to align with that. They're very interested in the measures that are being used. I think they're also, however, concerned about the ACOs and the formation of broader networks for the reasons we discussed earlier of the consolidation of markets. So I think that, and they're impacted by that in a very dramatic way. And then finally, the biggest issue for for employers is the Cadillac tax. The Cadillac tax, which is slated to go into place in 2018, is something that probably about 30% of employers at this point think will hit them immediately in 2018. Others, it will hit them within a few years of that. And so they are really have been for the past 2 years especially taking any and all measures to reduce their costs. And I think that's a major reason for the high deductible plans. They want action now. They will not pay that tax. They don't want to.
I mean, you know, we're a small company. We have 300 and some employees, and we project to be hit by the Cadillac tax because we have been against high deductibles. We have copays and so forth. But if you think about it, if you're an employer and you're the last person standing without high deductibles, let alone the Cadillac tax, think about the adverse selection that you will get with your employees.
Right.
So this is a huge issue, and I think the Cadillac tax is going to exacerbate this feeling that if I'm too generous, I'm really going to pay a big price for that.
So if you haven't gone to high deductibles now, how in the world are you going to sort of decrease your exposure?
I don't know.
Topic for another
Yeah, no, actually,
conversation.
active conversations right now within our company.
How about, so when we think of the ACA, any impacts on quality of care thus far?
Well, I think there's a lot of pieces of the ACA that are driving towards some of these delivery system and payment reforms that we've been talking about. They don't. In many cases, they don't predate those. They've been underway. I think the ACA certainly gives some tools and gives some direction in there. Do I think that will lead to better quality? Yes, I do. Have we demonstrated that has happened yet? I don't know. It may be too early. I will defer to the economists and the researchers.
We can show you many measures that we've been doing that have improved dramatically. I mean, diabetes care, for example, the complication rate for diabetes is down by half, and we're willing to take a lot of credit.
Well, and the other thing we've seen is we have seen some improvements in safety within hospitals.
Absolutely.
And that's, of course, a huge problem. I mean, 1 in 6 people admitted to a hospital suffers an adverse event. That's crisis level, in my opinion. So we have seen some incremental change in that, and certainly in some communities, dramatic change, particularly in certain measures such as central line infections. So that will have an enormous impact for all of us. So, and that's driven really in large part by CMS and the new value-based payment reforms, which really have had a significant impact.
They need to be applauded for their courage.
Absolutely. Yeah.
What about preventive services coverage and uptake? I mean, that was a component of the ACA. Do we know much on the measurement side about where that stands?
The preventive services, we haven't seen any big increase in performance on preventive services, but I think people are confused about first dollar coverage. So I don't know yet.
Great.
We see a lot of variation across plans. So I was visiting a plan recently where they make it their business to, at every visit, somebody has the information about gaps in preventive services and so forth. And they actually have eliminated disparities, believe it or not.
Wow.
Racial and ethnic disparities on the preventive services. That's pretty amazing.
Great. So there's certainly been some legal challenges to the Affordable Care Act, the 2 Supreme Court rulings in particular. Any other legal challenges or battles that are forthcoming?
Yeah, there is one that's working its way through the courts, and there was a recent decision on it. And it is about the cost-sharing subsidies. These are not the premium subsidies that people get in the exchanges, but also cost-sharing subsidies that are available to purchasers who are below 250% of the poverty line. And it turns out that though the law says that insurers will be reimbursed by the federal government for the expense of that, Congress never appropriated the funds for it. And the administration has been reimbursing insurers anyway. So if this lawsuit goes forward, and the recent decision was that the House does have standing to bring the suit, then there will be, remains to be seen what will happen as to exactly how those costs will be reimbursed. The insurers will still be on the hook for them. So it's not about whether consumers will get the subsidy. It's about how insurers will be reimbursed for them, whether it will be sort of in kind of real time or whether they have to go through an elaborate, exercise to get reimbursed.